Let's start with a question that might seem simple, but carries a lot of confusion, emotion, and even controversy. Is it better to have a penis with or without a foreskin? For decades, this topic has been buried under layers of cultural belief, medical opinion, and social stigma. In fact, the World Health Organization estimates that about 39% of males globally are circumcised, but the rates vary dramatically depending on where you live, how you were raised, and even what your parents were told in the hospital. And yet, so many men, especially over 35, have never had a clear, scientific, and shame-free conversation about it. Some wonder whether being circumcised affected their sensitivity or sexual health. Others were never circumcised and worry about hygiene, disease risk, or if they're missing something socially or sexually. This isn't just a cosmetic detail. The foreskin plays a role in sensation, protection, and function, but so does the rest of your anatomy. And when it comes to sexual satisfaction, infection risk, or long-term penile health, it's not as black and white as you might think. I see this often in my practice. Men who carry quiet questions or even regret about something they had no say in, or men who were told scary things online and want to know the real story. And more than anything, they want clarity, not judgment, not fear. So in this video, we're going to take a calm, evidence-based look at circumcision and foreskin, what the research shows, what matters and what doesn't, and how to take care of your sexual health either way. We'll walk through how the foreskin actually works, what science says about sensation and performance, risks and benefits of circumcision, myth versus fact, hygiene tips for both circumcised and uncircumcised men, what to watch for as you age, and how to talk to your doctor if something feels off. Whether you've had questions about your own body or just want to better understand what's normal, this is for you. You deserve clarity, not fear, so let's break it down, like I would in a real consultation. Let's start with anatomy, because to understand this conversation, we have to know what we're really talking about. The foreskin, medically known as the prepuce, is a double-layered fold of skin and mucosa that covers the glands, the head of the penis. It's not just extra skin. It's a specialized functional structure that serves several roles: protection, lubrication, and sensation. Think of it like an eyelid for the penis. It protects the sensitive head from constant friction, drying, and environmental exposure, especially in infancy and early development. In fact, the foreskin in young boys is usually fused to the glands and only naturally detaches over time, a process called physiologic phimosis, which is normal and protective. Inside the foreskin are mucosal cells similar to those in the inner eyelid or the inside of your cheek. These keep the glands moist and maintain a natural bacterial environment. There's also a high concentration of fine touch nerve endings, particularly in a structure called the ridged band, located near the tip of the foreskin. In a 2007 study published in the British Journal of Urology International, researchers found that the foreskin contains more fine touch receptors than the glands itself, suggesting that it plays a significant role in the mechanics of sexual sensation, particularly during the movement and gliding action of intercourse. It's also been proposed that this gliding mechanism reduces friction and helps preserve natural lubrication during sex for both partners. That's part of why some men report changes in sexual experience depending on circumcision status, especially if circumcision occurs in adulthood. Now, does that mean the foreskin is essential for sexual health? Not necessarily, but it does mean that it serves a function and that removing it changes the physiology of the penis. Let's also bust a myth here. The foreskin is not inherently dirty or problematic. With basic hygiene, it's entirely possible to keep an uncircumcised penis clean and healthy. The problem is that many men are never taught how to care for it, and that lack of education can lead to preventable issues. So if you're uncircumcised, know this: the foreskin is not a flaw. It's part of your natural anatomy. Like any part of your body, it deserves knowledge, care, and attention. And if you are circumcised, especially from birth, none of this is meant to create guilt or regret. You simply have a different anatomical baseline. The key is understanding how it affects your experience and how to work with what you have. This is one of the most emotionally charged parts of the conversation and one of the most misunderstood. Many men wonder, if I'm circumcised, did I lose sensitivity? And if you're not, you may wonder, am I missing out on something others talk about? Let's break this down like I would with a patient, calmly, clearly, and based on research, not internet noise. First, it's true that the foreskin contains specialized nerve endings, especially for light touch, called Meissner's corpuscles. These receptors are similar to the ones you find in your fingertips or lips. They're concentrated particularly in the ridged band, a ring of tissue just beneath the tip of the foreskin. That said, sexual pleasure is complex. It's not just about nerve endings. It involves pressure, temperature, psychological arousal, emotional intimacy, hormones, pelvic blood flow, and more. Think of it like this. Your body is a symphony, and sensation is one instrument, not the whole orchestra. In 2015, a systematic review published in the Journal of Urology evaluated 36 high-quality studies comparing sexual function in circumcised and uncircumcised men. The researchers found no consistent difference in sexual satisfaction, erectile function, or orgasm quality between the two groups. While individual experiences varied, the overall conclusion was that circumcision does not appear to impair sexual function in a clinically meaningful way. Another key study from the International Society for Sexual Medicine in 2017 emphasized the importance of context. Circumcision performed in infancy versus adulthood can yield different experiences. Adults circumcised later in life may report changes, sometimes positive, sometimes negative, but these often reflect the condition that led to the surgery, such as tight foreskin or chronic infections. Here's what this means for you. Circumcision may change the mechanics of arousal, but it doesn't eliminate pleasure or function. Many men who are circumcised report full, satisfying sexual lives. Many who are uncircumcised do as well. Sensation is shaped by far more than anatomy. If you're feeling uncertainty about your own body, you're not alone. I've spoken with countless patients who carry doubt, sometimes shame or frustration about things they didn't choose. But remember, how you feel about your body matters more than the statistics. And your brain, not just your foreskin, is your most important sexual organ. But here's something practical. Regardless of circumcision status, healthy pelvic circulation, testosterone balance, emotional connection, and regular communication with your partner all matter more for long-term satisfaction than whether you have foreskin or not. If this resonates, comment below, because this conversation deserves more honesty, more nuance, and more healing. You're not broken. You just need the full picture. Now we'll tackle a big area of medical debate. Does circumcision protect against infections or increase risk? What's the truth about hygiene, STIs, and penile cancer? One of the strongest arguments historically made for circumcision, especially in Western medicine, has been the potential reduction in health risks, infections, urinary tract issues, and even cancer. But like many medical topics, the truth is more nuanced than a simple yes or no. Let's start with hygiene. For uncircumcised men, the foreskin creates a warm, moist space under which smegma, a combination of shed skin cells, oil, and moisture, can accumulate. If not cleaned regularly, this buildup can lead to irritation, foul odor, or infection. That said, proper hygiene, gently retracting the foreskin and cleaning underneath with warm water is usually all that's needed. No soap inside the foreskin, no scrubbing, just consistent, mindful care. So when you hear that uncircumcised men are dirty, that's stigma, not science. Now let's talk about infections. Several studies, including large trials funded by the NIH and published in The Lancet, found that circumcision can reduce the risk of certain sexually transmitted infections, STIs, including HIV, HPV, and herpes simplex virus type 2, particularly in high-risk populations. These studies, often conducted in sub-Saharan Africa, led to global health bodies like the World Health Organization recommending circumcision as one tool, not the only one, to reduce HIV transmission in specific settings. But here's the key. These benefits are more pronounced in environments where access to condoms, regular STI testing, and education are limited. In Western countries with robust sexual health infrastructure, the benefit-risk balance is more even. What about urinary tract infections? In infants, circumcision slightly reduces the risk of UTIs, especially in the first year of life. But the absolute risk is low. About 1% of uncircumcised infant boys develop a UTI versus about 0.1% of circumcised boys. In adult men, UTIs are uncommon, regardless of circumcision status. Now, let's address the word no one wants to hear, cancer. Penile cancer is exceedingly rare in developed countries, about 1 in 100,000 men. Uncircumcised men may have a slightly higher risk, particularly if they have chronic inflammation, poor hygiene, or a history of HPV infection. However, good hygiene and vaccination against HPV virtually eliminate this risk for most men. The American Urological Association currently does not recommend routine circumcision for cancer prevention alone. Instead, they advocate for informed decision-making based on individual context. So here's the summary. Circumcision can reduce certain health risks, but they are low to begin with in most men, and they can often be minimized with good hygiene and sexual health practices. If you're uncircumcised, daily care and regular check-ins with your doctor go a long way. If you're circumcised, you still need to maintain overall penile and sexual health. Circumcision is not a get-out-of-jail-free card. This is something I tell my patients often. Whether you're circumcised or not, awareness is the real protector, not just a procedure. Let's talk about something that doesn't show up in lab results or clinical trials, but matters just as much, how men feel about their bodies. Because whether you're circumcised or not, the way you view your penis can deeply impact your confidence, self-image, and even your sex life. This is something I see often in the clinic, and it's not talked about nearly enough. Some circumcised men, especially those circumcised as infants, express regret or sadness, not because they're in pain or have dysfunction, but because they feel something was done without their consent. Others worry they've missed out on sensitivity or sexual experience, especially after seeing information online. There's a growing intactivist movement that amplifies these voices, and while some of the information is valid, it's also important to stay grounded in facts, not fear. On the flip side, some uncircumcised men carry shame or embarrassment, especially if they grew up in cultures where circumcision was the norm. They may worry they're different or that a future partner will judge them. Some even avoid intimacy out of fear or body insecurity. But here's the truth. Your value, your masculinity, and your sexual worth are not determined by a piece of skin. They're shaped by your confidence, your health, your communication, and your relationship with your body. In a 2019 qualitative study published in Sexual Medicine, researchers found that circumcision, regret, shame, or confusion often stemmed not from the physical changes, but from a lack of education, autonomy, and open dialogue. Men who understood their bodies, had support, or were able to talk about their feelings were less likely to carry distress. So if you've ever felt unsure, disappointed, or even angry, that's okay. Your feelings are valid, but you are not broken, and you have more control than you think. If you're struggling with self-esteem around your circumcision status, here are a few things that help. Talk to a therapist or men's health specialist, especially one trained in sexual health. You're not alone, and this is more common than you might think. Focus on what you can control: pelvic health, sensation through mindfulness, communication with your partner. Learn your body's language. Understand how arousal, touch, and comfort work for you. Your brain, your hormones, and your blood flow all play a bigger role in pleasure than foreskin alone. And if you're in a relationship or dating, openness helps. You don't need to justify your body, you just need to own it. If this is helping normalize things for you, leave a comment. You never know who else might be holding silent questions. Let's open that door together. Now let's move into the most practical part of this video: how to care for your penis, whether you're circumcised or not, and the essential habits that protect your sexual and urinary health as you age. Now let's shift into something practical: how to care for your penis in a way that supports long-term health, comfort, and confidence. Whether you're circumcised or not, this part of your body deserves mindful care, just like your heart, your joints, or your digestion. But because it's such a private topic, many men were never taught the basics. So let's walk through it together, like I would with a patient. If you're uncircumcised, the foreskin requires gentle, consistent hygiene. Here's how. Daily cleaning. During your shower, gently retract the foreskin and rinse the area with warm water. Avoid soap. It can irritate the delicate mucosal tissue. Think of it like cleaning the inside of your eyelid. Gentle, not aggressive. Dry carefully after rinsing. Pat the area dry. Never leave the foreskin retracted for long periods. It's meant to cover and protect the glands. Watch for signs of inflammation. Redness, soreness, or difficulty retracting the foreskin can indicate balanitis or phimosis. These are treatable, but they require attention, not avoidance. Check in regularly, just like you'd inspect your skin or gums. Occasionally take a look at your penis in good lighting. Notice any changes in color, texture, or sensitivity. If you're circumcised, hygiene is more straightforward but still important. Clean daily with warm water and mild soap on the shaft and glands, but again, avoid harsh cleansers or antiseptics unless directed by a doctor. Moisturize if needed. Some men experience dryness or irritation around the scar line, especially in colder climates or with friction. A small amount of unscented emollient or natural oil can help. Protect during intimacy. Use adequate lubrication to reduce friction. This benefits all men, but is especially important for circumcised men who may have less natural gliding during intercourse. Now, for everyone, here are 5 universal habits that protect penile and pelvic health. Stay sexually active or simulate sexual stimulation. Erections bring oxygen-rich blood to the penis, which helps maintain tissue elasticity and nerve sensitivity. Exercise your pelvic floor. Kegel exercises aren't just for women. They improve blood flow, erectile function, and bladder control.